Welcome to the CPRN webinar entitled How to Join the Cerebral Palsy Research Network, or CPRN. My name is Paul Gross, and I'm the chairman and founder of CPRN, and I look forward to taking you through the background of CPRN and the steps to join the network. CPRN was founded as an initiative out of an NIH workshop entitled The State of Science and Treatment in CP that was held in November 2014, where there were 5 key takeaways and task force leaders agreed to lead efforts for each of these key takeaways. One was to start a national cerebral palsy registry. The second was to pursue more comparative effectiveness research questions. A third was to increase the amount of study about adults with CP and lifespan-oriented research in CP. The fourth was to bring more young clinician scientists into the field. And then the fifth was to advance basic and translational science for cerebral palsy. The Cerebral Palsy Research Network was really founded to do 1 through 4. It was born out of efforts to start the National CP Registry and then ended up expanding to encompass the other 3 topics as part of its development. It's really a merger of 2 core experiences from 2 of the co-founders. My experience with the Hydrocephalus Clinical Research Network, or HCRN, which I co-founded in 2006, that has a registry at its core and conducts high-quality clinical research and quality improvement in neurosurgery. And then the Learn from Every Patient learning health system that's been developed at Nationwide Children's Hospital. And Dr. Gary Noritz there was very instrumental in that program and was a key person on the founding team of CPRN. And then lastly, CPRN was founded to be patient-centered from the outset, and part of that is because of my experience as the father of a boy with cerebral palsy, and then my belief in that, which had us incorporate another parent as a patient or community engagement person from the outset. So the mission of CPRN is to improve outcomes that people with cerebral palsy value most through high-quality clinical research and quality initiatives. And so that phrase, that people with CP value most, is intended to capture our central purpose of being patient-centered. And so we'll talk a little bit about process that we've gone through to make sure our research agenda is focused on things that the CP community cares about. So what is it? It's really a collaborative network of institutions and clinicians and therapists and researchers within those institutions, along with patient advocates that are committed to conducting high-quality research and quality improvement initiatives in cerebral palsy. It's a data coordinating center, or DCC, that's at the University of Utah's Department of Population Health Sciences. And then at its core, it is both a clinical registry that characterizes the patient population treated at those centers, the interventions, and their outcomes. And that clinical registry is both built into Epic, the leading electronic medical record system, and it's also built into REDCap, and we call that the CPRN Clinical Registry. It's also a patient-reported outcomes registry that follows both children and adults longitudinally, and that's called the CPRN Community Registry. So where is CPRN? There are approximately 20 sites. You can see pins for where they're located, but if you want to get the details about the actual institutions and who the PIs are, you can go to cprn.org and look under network to get more details. Our leadership team is formed out of a number of these centers and really work together to both define the registry up front and to sort of put together the initial plans for the Cerebral Palsy Research Network. So what is its status? Currently we have 14 of 20 sites that have signed up that have already gotten an institutional review board approval for the registry protocol. And we have 13 sites that have a business associates or a data use agreement in place, which allows the data to be moved from that site to the registry at the University of Utah. 6 sites are actively collecting data in the clinical registry. 2 are using the EMR-based mechanism, both Nationwide Children's Hospital and the Children's Hospital of Colorado. And then 4 other sites are using REDCap, including Seattle Children's, Children's of Alabama, Gillette Specialty Care, and Primary Children's. And then we've got more sites that are getting ready to do EMR capture in Epic that are listed there, probably Texas Scottish Rite and University of Virginia that will be the next sites to come online. And we're working on getting the capability developed for other EMRs. I'll talk about that in a bit. The Patient Reported Outcomes Registry, or PRO Registry as we call it, in addition to calling it the Community Registry, is built in REDCap, and it's launching soon with some adult studies and some pediatric longitudinal studies. And our standard operating procedures, or our sort of manual of operations or governance for the network, has been finalized, and it really makes us open for business to both take in new sites and to allow studies to be proposed both from within the network and outside of the network. So to continue on the status, the Data Coordinating Center, or DCC, is funded already and to create and manage the registry over several years. The registry data elements have been defined, and there's been work done to align them with the National Institute of Neurological Disorders and Stroke CP common data elements, which were defined roughly at the same time as CPRN's founding. And then the Patient-Centered Outcomes Research Institute, or PCORI, funded an initiative called Research CP, which was a joint initiative between CPRN and CP Now that was used to define a set of patient-centered priorities. So there was broad participation by both the patient community as well as the clinical community to set a set of research objectives and priorities for the community. And then we've got several study groups that are actively defining study concepts. This is a little look at our study pipeline. If the x-axis is time, it's not exactly linear, just to be clear, but just to give you an idea of some of the stages. At the front of the funnel, we have several studies being developed that have not been reviewed as concepts. Our standard operating procedures have a way in which studies are developed and reviewed before they move along the pipeline. We've had a number that have been reviewed, some of which have been submitted to NIH for funding, like the Kruer genetic study. And then we have some that are in various stages of study implementation, including the PRO registry and for adults, and the clinical registry, which is already deployed, but being deployed in more places, as we've described. And then we have 2 manuscripts that are under development, one about the research priorities as defined by the community, and another about the defining of the CPRN registry overall. So lots of real work happening already with the network. So what are our plans for half 2 of 2018 and beyond? And half 2 is using the fiscal year of July through June, that is the academic calendar. Key thing in the second half of the year is to expand the registry trial to get more sites up and running and executing, to get more of the forms that we've implemented for the registry to be implemented in Epic. So we went out initially with non-surgical forms, and we are in the end of October 2017 going to launch orthopedic and neurosurgery forms. And then we're working slowly but surely on developing Cerner and Allscripts forms. The Cerner forms are being developed by Gillette, and the Allscripts forms are being developed by Phoenix Children's Hospital. We also hope to develop and advance numerous studies. As you saw, the pipeline has got lots of things in front there. We want more things coming in. And we have one QI protocol that's been defined, and we'll be working on implementing that. And the whole sort of model for CPRN is to get studies that we can submit to public funding agencies to fund the work. And we want those to be studies that are on the opportunity map that was defined by Research CP. The community registry is going to launch imminently with a set of adult studies on pain and social and emotional development and employment, along with capturing some core patient characteristics. And then we've licensed the CP Pro measures of mobility in CP from the Boston University. So what we would recommend that you do is really spend some time to research what it means to join CPRN. Listening to this webinar is a great first start, but you should really invest time in understanding where we are, where we're going, and what it would mean for you. So some steps you can take to do that are, if you go to the cprn.org site and look under Learn More, there is a resource page that has really everything that we're doing. So you can download and read the CPRN mission, vision, and strategic plan. You can read our standard operating procedures and understand how we operate, how we govern ourselves. And then you can browse multiple webinars there to understand things like what it's like to use the EPIC forms to generate clinical notes and the registry data, to hear various presentations we've done. And you can basically sit in on a recording of one of our investigator meetings to understand what those agendas sound like and the kinds of discussions that we have. Then I'd say you really should understand the commitment that would be required of your team, of your practice, and of you as a principal investigator, and engage your partners and your chief medical information officer. So one of the key things is this requires a change in practice. And so are the clinicians on your team willing to participate if it requires a change in practice? And the core change in practice is around the way notes are created. And there's lots of information about that. And then, does your institution have the infrastructure to support the CPRN registry? And that means, is there departmental support for doing clinical research or for doing quality improvement, or both? Is your site EPIC based? That's really a key thing to make it the easiest to do. If not, is there a way to get access to a clinical research assistant, either part-time or full-time, to support doing chart abstraction to get going with the registry beforehand, before there's form support for your electronic medical record system? And then, do you have time to be a principal investigator? The model calls for a principal investigator and an alternate PI, and it does require a time commitment. And do you have departmental support to be spending time on research or quality improvement? So what are the steps to join CPRN? First is to send me an email at paul@cprn.org to convey your intention and interest in joining the network. And then after you've reviewed many of the materials we've talked about, you can arrange any necessary follow-up calls with me or colleagues or people in either the IT side or practice partners to sort of understand the ramifications of joining CPRN. And really what we consider the first step is listed as step 3. It's really showing that you're committed, because this takes significant time investment, is to submit the CPRN registry IRB protocol. That can be found on our resources page on our website. We're glad to handhold in advance of that to help you through anything that's unclear and getting that submitted to your IRB. And when you share that IRB submission with us, then we will send you an invitation to join the network, and that gives you a letter and a form we want you to send back with some signatures from your practice partners that are going to participate in the network and from your CMIO. And then you're off and running, and you can request the EPIC forms through your EPIC analyst. You can join our bi-monthly investigator calls, which happen on the first Monday and third Tuesday of every month. Those calls are typically 30 to 60 minutes, depending on our agenda, and they're all recorded and available, as you've probably seen on our website. And then lastly, you're the point person to introduce your legal contacts to the appropriate contact at the University of Utah so we can execute a business associates agreement, which will allow the data sharing for your data from your site for the clinical registry to be scrubbed and integrated into the University of Utah housed registry, CPRN registry. So what are some of the challenges along the way? There's very often an initial fear from clinicians that they're going to be capturing the data and are they going to be turned into a clinical research assistant? So since this does represent moving to a forms-based mechanism, some clinicians are less comfortable with that. It means interacting with the patient and the computer at the same time. And so people just are like, I dictate my notes, I know how I do this, and that's all there is to it. And so that can be a barrier. In doing the IRB, we ask you to get a waiver of consent so that we eliminate selection bias from the entrance into the registry. That's often a challenge with some IRBs and requires some defense. We ask people if they can't get that to back down to an opt-out for participation in the study, because that actually does a good job of eliminating selection bias as well. So we're glad to help you with that and have some resources to help with that. Getting the attention of your IT staff and getting support to get the forms implemented. The CPRN registry is actually implemented in Epic already, but getting the forms that connect to the registry does require some Epic analyst support, and that can be a very precious resource in some institutions. Changing practice to use the forms, as I mentioned, with instead of just assuming it's research and therefore you're going to rely on a CRA. That is not only a fear piece, but it's actually a challenge, as we've discovered as we roll this out, is to get, have all the right things on the form based on the way your practice is set up. Do you have patients come into clinic and move between clinicians, or do you do a scrum where the patient is in with a group of clinicians from multiple disciplines for 20 or 30 minutes? Those required potentially different form layouts and whatnot. And so that can be a challenge. The time required to execute a business associates agreement is often 3 to 4 months just because of back and forth. Avoiding using a data use agreement, which most attorneys will look at what we're doing, and their initial sense will be that for conducting research, a data use agreement is the right agreement shape. But as it turns out, since the University of Utah plays the role of a business associate at first to scrub the data, to prepare it for research, that's a typical business associate agreement usage. But then to actually conduct the research, University of Utah is a partner there, and therefore a BAA makes it so we can do this in a single agreement that can be applied to multiple studies along the way. Not having Epic is a challenge because we don't have forms implemented for other EMRs at this stage. And then serializing steps of IRB, then BAA, then requesting forms just slows the whole process down. So some of the discussions that we have with people when sort of talking about this with their institutions are, what it takes to initiate research or quality improvement within your institution. What's the institutional view of QI versus research and the level of support for it? Is there any external funding to support the effort? Which there is not. Our model is to pursue public funding, and therefore we're asking you to make an investment up front to be able to participate in these future funding opportunities and really get in on the ground floor. What if my CP practice doesn't have all of these different disciplines? And that's okay. This is also a large study in practice variation. So say if your site doesn't have neurosurgery, that doesn't mean you can't participate in the registry. They're just forms that you won't use. And really, how do you handle the non-EPIC scenarios? And so we've got sites that have a CRA that's partially allocated to this effort, and maybe they're only collecting information about neurosurgical cases or certain orthopedic cases or just PT. And then we have other sites that have all disciplines implemented, and that requires different levels of time commitment from a CRA if you're going to use REDCap until we have a form solution for your environment. So that really is the step. Those are the steps to join CPRN. So what I'd say in summary is to invest the time to determine if it's a fit for you and your institution. Lots of resources to make that determination. The start is really with the CPRN registry protocol. That's the way to get invited to join CPRN. And then make sure you ask us for support along the way. We're here to help. Send me mail at paul@cprn.org. Thanks for your time. I hope this has been useful, and please feel free to send me mail with any questions that you might have.